Hi, my name is Gabby. I'm going to be your nurse today, and we're going to be doing the cranial nerve testing on you. The first cranial nerve is the olfactory nerve, which is your smell. That will not be testing today. But the second cranial nerve is the optical nerve. With the optical nerve, we would test your visual acuity using the Snellen chart. With this, you would stand 20 feet away from the chart. You'd cover your left eye and read the lowest line that you could on the chart without missing 3 characters. If you do miss 3 characters, you fail that line and you move up a line. Normal vision for an adult is 20/20, and the number would be charted fractionally. Next, we're going to check peripheral vision. Could you close your left eye? Whichever. Okay. All right, now tell me what number you see.
1, 2, I can't see it, 3.
3, okay. Now switch to the other eye.
2, 1, 3.
Okay. So cranial 2 is intact. Next is cranial nerve 3, the ocular motor. With this one, we check for extraocular movement. So I'm going to have you keep your head straight, look right at me, and follow my finger. Actually, sorry, look at my finger. Follow my finger, not your head, okay? Okay, that was using the starburst technique. And no nystagmus noted. Now we're going to check the direct pupillary response. So if you could look right at me. Okay, pupils are about 2 to 3 millimeters and are equal, round, and reactive. Now we're going to test indirect pupillary response. Okay, constriction is brisk in both eyes, so cranial nerve 3 is intact. Next, we're going to check cranial nerve 4, the trochlear nerve, which has the accommodation. So I'm going to have you stare at this pen here. Okay, patient has accommodation in both eyes, so cranial nerve 4 is intact. Next is cranial nerve 5, the trigeminal nerve. I'm going to feel your... Okay, now try and open your jaw against resistance. This side, this side. Okay, and then the sensory portion, we would check the face, scalp, and cornea, and sensation in the face, as well as the mucous membranes and the nasal membranes with cotton swab or cotton covered tip. So cranial nerve 5 is intact. Now we're going to test cranial nerve 6, which tests lateral movement of the eyes, which we already tested for in cranial nerve 3. So we're going to say cranial nerve 6 is intact. Next is cranial nerve 7, the facial nerves. We're going to test the muscles of mastification. Can you make a chewing movement? You do it with your mouth open. Okay. Then labial speech. Can you close your eyes and say your name?
Dan Ciolek.
Okay. Lips move bilaterally. And then can you smile, frown, and puff out your cheeks? Okay. We would test taste by providing the patient with something that is sweet, salty, and sour. And then test their tears by stimulating the cornea with a cotton ball. And then we would also test the saliva by providing a sour substance. So cranial nerve 7 is intact. Next is cranial nerve 8, the acoustic nerve. So I'm going to cover your ear and whisper in.
Softball.
Okay, let's check this one.
Football.
Okay. So hearing is intact bilaterally per the whisper test. We would do the equilibrium test when we do the head to toe assessment by assessing their gait, but cranial nerve 8 is intact. Then we have cranial nerve 9. Can you say ah for me? Okay. And then I would test the gag reflex by using either a gloved finger or a tongue blade. But cranial nerve 9 is intact. Next we have cranial nerve 10, which is the vagus nerve. Can you say your name and date of birth for me?
Dan Ciolek, 2/23/1957.
Okay, no hoarseness is noted. And then can you swallow for me? Okay. So cranial nerve 10 is intact. Next is cranial nerve 11, which is the spinal accessory nerve. I'm going to have you move your head to one side, turn your head one way against resistance. Okay, good. The other way. Okay, back. Good. Down. Okay. So cranial nerve, and then lift your shoulders up. Okay. Cranial nerve 11 is intact. Next is cranial nerve 12. Can you stick out your tongue for me? Tongue is midline, and then can you move it back and forth? Okay. Cranial nerve 12 is intact, and that completes my cranial nerve testing.